Celebrating the baby boomer lifestyle. This is Boomer Life with Sterling Fox on AM 650.
Celebrating the baby boomer lifestyle indeed. Welcome back to the program. In studio, we have a boomer and a baby as we're talking with our guests from the Integrative Naturopathic Medical Center. The boomer is co-founder, Dr. Lawrence Chan, and Dr. Alex is the baby, and she's some baby, I'll tell you, a naturopathic physician on the team now for what, 2 years, Alex?
2 years, yeah.
Okay, and a specialist in cancer treatment. You and your father, leading edge people in that regard. You will see many of the cancer patients who show up at Integrative,
That's
right?
true. We work in a very joint effort with that.
Larry, when we did the show on cancer last month, you talked about something called a biological terrain. What is that?
I think the best way of describing biological terrain is really it's kind of the key of how naturopaths will look at the body, the human body. So we talk about how prevention occurs and how the interplay between environment occurs with the human body and how health is attained by that. So think of, I think if you look at best is describing a soil on land.
Okay.
You look at a piece of earth that you're trying to grow vegetables or flowers on. If you know the quality of the soil, you'll have a good idea how well the things will grow on.
And what types of things to plant in it, right?
Yeah, so for example, if the soil quality is rich in nutrients, if it's rich in oxygen, and if it's got the right acid-base balance, you know that flowers will grow well. If the soil is poor nutritionally, poor quality, it's got lots of toxins on the soil or pesticides in the soil. If the quality of the soil is a poor quality from an acid standpoint, so too much acidity, you're not going to get very good growth of vegetables on it as well. So really, our way of testing in our clinic is see what the person's terrain is, what their biological terrain is. Because if their terrain is one of health, we will keep them in that way. If their one is off balance, we'll try to get them into a balanced terrain to maintain their health over the long run. And this could apply to everything from autoimmune diseases to preventive medicine to cancer treatments. How do we keep their terrain healthy?
And we can affect a lot of that terrain, too.
Okay.
So something as simple as drinking enough water will change, if the soil's really dry, dehydrated, right? If the person's really dry or dehydrated, that doesn't set their cells up to be able to go through the cell respiration and breathing that it needs to go through and the oxygen transport that it needs to go through. Things like if they either eat a very poor quality diet or if their digestive system isn't allowing them to absorb the right nutrients, once again, you're going to have a worse biological terrain.
Okay. So this is all. Could this be considered part of the big picture? So when someone comes into Integrative Naturopathic Medical Center, Dr. Alex, they're going to receive a biological terrain map of themselves as part of their of the service provided.
Yeah, there's definitely different ways that we assess that. We'll assess that through the clinical history, physical exams, but then there's also in-house sort of specialized testing that we'll do that gives us a sense of that. So we have different tests using blood, urine, saliva, other, body fluids and that type of thing to really look at those parameters as far as acid base, pH, and mineral content.
So it's all about being a balanced human being, emotionally, physically, and how many of us typically are not terribly well balanced? I would guess, Dr. Larry, a huge percentage of us, just not quite centered the way a naturopathic physician would like us to be.
I think the key thing is, you're right, the key thing is always try to attain that balance. We're always reaching for that because everyday stressors on our body, whether it's emotional stressors or work stressors or environmental stressors from pollution, lack of sleep, all those things, poor foods, all those things create a imbalance in our body.
Right.
So how do we affect our bodies to become balanced? That's the key thing. So how do we identify where those holes are in the body and how do we get ourselves back into that balance? So you're right. We always want to attain that balance.
So when one comes to the center, Dr. Alex, I'd like you to put me through whatever you got. I need a checkup, and I need a different kind of checkup for a change. Because typically a British Columbian will see his or her doctor on average slightly less than 15 minutes per appointment. And unless there's a serious medical situation going on, that's generally once a year.
Yeah.
So we get 15 minutes a year. Some of us are a little displeased with that and would like a little more attention for any number of reasons. So that's why Integrative Naturopathic Medical Center is there.
Sure. So if you walk into our clinic as a new patient, depending on which naturopathic doctor you see, it'll be a range of anywhere from your new patient visit will be anywhere from, I would say, 20 minutes to just under an hour, depending on who you're seeing.
So that's already 4 conventional doctor visits, isn't it?
It is. And, depending on which of some of the senior partners have a little bit more skill in sort of honing in, I think, a little bit faster than maybe myself. But so you get a lot more time.
Okay.
And that conversation will be with the naturopathic doctor that you're seeing. We'll go through a complete history, physical exam, and really, usually we don't start treatment at that visit because we like to take the time to really get a sense of what's going on, and then also find out if they've sought out any other lab testing from a conventional doctor, if they've seen any other specialists, have a chance to get those records in-house. So we have a really comprehensive view.
So let me interrupt you there because I want to make sure I understand. If I come to see you for a little more specialized treatment than the 15 minutes I get from my doc, and you go, okay, well, thanks for coming in, and let's have a chat, and let's do some basic stuff. Are you on any kind of medication and all that kind of stuff? And if I am, will you reference my doctor and get my medical file and all of that stuff? And do you usually get a cooperative response?
I would say that I ask for medical records on most every new patient I see, I would say.
Okay.
And then as far as the cooperation, well, technically the patient medical records belong to the patient.
Right.
So every single patient has the right to request their chart. So any
Really?
doctor who's,
So if you can say to the doctor, I'm going to another place, it's not the competition really, but they're going to want to see my medical records. So can you arrange to have them sent down to the Integrative Naturopathic Medical Center? They're your records, so you're in charge, right?
Usually our staff tries to make it one step easier. Before you leave our clinic that first day, we'll have you sign a release of medical records saying, and we'll fax that off.
You'll take care of it for me.
Yeah.
Okay.
Sometimes, unfortunately, we do run into some resistance where certain clinics are more happy to give the record directly to the patient instead. But then if that happens, you can get the records for me and then just hand deliver them.
See, now there's something already, friends, that you're just listening to the program today you may not have known about. Those records in your doctor's office belong to you.
And actually, a new thing that's available in BC is every single time you get a new lab test done, if you register online at something called My eHealth, you can have access to your labs online anytime you want.
Oh, really?
Yeah. And you can print out a copy and bring them in to your first visit even.
Oh, is that right?
In hand. So you'll see the doctor, and then you'll also see our support staff. So included, and this is something that we do differently than a lot of other naturopathic doctors, not only do you get your ND visit, you also get a complimentary 15 minutes intake with my nutritionist. So she'll do a conversation with you more specifically around diet. And then you'll also have some in-house testing done with my naturopathic assistant. So that will range depending on what your concern is, from some muscle strength testing to certain other sort of diagnostics that we do.
Larry, what happens if, and I'm going to use an example you've given us in the previous programs, because you're a veteran of these BoomerLife appearances. Somebody comes to the doc and says, I'm just out of sorts. It's not all there. And the doc says, well, let's get some blood tests here. It could be a problem. The blood work comes back, no problem. Guy comes back 6 months later. I feel even worse. I'm sluggish now. It's more blood work, no particular results. 6 months later, the guy can barely get out of bed.
Right.
So, okay, this is an example you've given in the past. That first visit, how might that process have been accelerated that it didn't need to take 18 months? It could have taken 18 minutes if the right questions were asked, or am I off track there?
You're absolutely right on track, because what happens is that from the allopathic doctor, their standard medical doctor, they're looking for a disease process right away. And if none presents itself, no pathology is there, they don't see it. What we're looking for right at the beginning, what Alex was mentioning, in our testing procedures, a visit with a nutritionist, doing different diagnostic testing that we have. We actually do some electrodermal testing, which looks at the health of the organs and stress on the organs themselves. whether it's toxicity patterns or whatever else. We look for those things right at the very beginning.
Okay.
And if they came in with that, we would have seen some of those patterns already emerging at that point.
And a change in function, not not necessarily
Pathology.
a change in pathology.
Right. So, because you know you're off your game. You may not even. It's like if you have a cold, you're completely out of it. You get up and you get dressed and you just want to go back to bed. You've worn out your energy supply. Well, if you don't have a particular affliction of any kind,
Right.
but you're just out of gas
Well,
all the time.
Well, that's exactly a typical one is fatigue. And when a person comes in and says, I just feel terrible, and then a year down the road after many tests, they finally see there's a problem. Now the problem is the fact that you're getting an adrenal fatigue in your body.
Mm-hmm.
You can't function. Well, actually, what occurred before was the fact that we would have caught the fact that maybe they couldn't digest properly.
This would have been part of the mapping of the biological terrain.
That's right. At the
wouldn't
very
it?
beginning,
Yeah.
the person wasn't digesting properly. They weren't absorbing the food properly. They weren't getting the right nutrients to activate their cells, so they're not producing energy. So that's why they're starting to fatigue early. Now it's affecting a number of things, and down chain, eventually it'll show up as a problem with an organ.
Well, that is the issue, isn't it, really, Alex? Because if you have one thing that's throwing you off a little and it's not addressed, then the snowball effect can very quickly kick in. And by the time you are finally confronted by a doctor or an emergency room physician, it's a real issue that may, 18 months ago, have been something as easy to deal with as a tweak to the diet.
Mm-hmm. That's very possible. Or, I mean, another one that's really common is something like called hypothyroidism or thyroid problems, and that can really affect energy. And there's a very simple test that usually is done if people complain of something like fatigue, which is it's called the TSH. It's thyroid stimulating hormone. So that's a really common test that your MD might run. But the thing is, there's a reference range on what's normal with thyroid function that goes up to a level of something like 4.5. And outside of, over and above that is kind of, you're trending towards it, and then as it gets very, very high, then it basically is a problem.
Okay.
For our perspective, I generally start to worry that maybe someone's thyroid is not working quite as well as it should if it's trending above 2.5.
Oh,
so
okay.
because what I'm looking for is optimal function, right? And there's a lot of MDs that are changing their perspective on this too, and starting to be concerned if it's 3.5, getting closer to that top of the range.
To what used to be.
Exactly.
Yeah, right.
But technically, a lot of labs will still say, oh, as long as it's under 4.5, it's no problem.
Right.
And so that's one of those things where you see that trend, and that could be because of something like diet. It could be because of something like stress. And so there's other tests that we do that give us a little bit more information around that too. And at that point, it might not be something like thyroid medication that you need. It might be something that we could support just through certain nutrients in the diet,
right, yeah.
or through herbs. And so that's a lower level of intervention.
Yeah, and it's also about not we look at things non-cookie cutter. Everyone is an individual. In the case of the thyroid, that person may be fine at 3.5 in that number 4, but another individual may be too low. The thyroid is too low.
Right.
So everyone's different.
Sure.
We need to look at people as individuals. That's what we're good at doing.
Well, one of the things that certainly stands out, the naturopathic approach as differed from the Western approach that we're more accustomed to, is the insistence on the integration of mind and body. The whole spirituality as connected to health is a dimension that is absolutely just not there in Western medicine at all. How important is it in naturopathic medicine?
It's critical. It's our foundation. It's our core belief system. If you don't have a balance between the interplay between those factors, you can't be healthy, because something is going to be missing somewhere down the chain. And in the old days, like you mentioned earlier before, a doctor says, even doctors will say, well, if you're not happy, if you're not having favorable attitude, you may be sicker.
Absolutely.
Or you're stressed, you may be sicker.
Yeah.
And that was always a thought before. We always thought maybe it was true, because it was obvious it was true. But now we can actually measure it. It's measurable now. Yeah. You can measure the fact that if you're stressed, your cortisol levels, which is a hormone, goes up. That can create all kinds of destructive elements in the body. And that's all measurable now. So what was once thought as being, kind of folk medicine, kind of lore, is now actually true. And it all ties into that. Stress is emotional. affecting biochemistry,
Sure.
affecting organs and health.
Well, it's always been true. It's just now we have studies that we can
That's
point
right.
to
It's always
show
been true.
it.
Now we can
Yeah.
see it.
Well, and that's the key, though, isn't it? In terms of winning over not only society but also the other parts of the medical community. They're science-based, and the evidence is going to be the ticket, isn't
Well,
it?
and now we can prove things like deep breathing and meditation are important, and it makes a difference to how your body does, that you're getting good breaths, which, I mean, seems like a very obvious thing, but it's good that we now have the research to be able to point to, because it does help to win over more people that it's like, hey, you need to take a minute. You need to stop and actually take time to breathe properly, eat properly, all of that.
Yeah, we're as much committed to scientific evidence as anybody else.
Of course.
But the problem is that if you just rely on scientific studies and evidence, you may be waiting till the cows come home before you actually get the studies to prove
I
what's
think
obvious.
we should not breathe until we have those studies.
That's exactly the case.
Oh, please. I need to take at least a couple of breaths, and I need to take a quick time out. We're going to just pause for a couple of seconds and return with our guests, Dr. Lawrence and Dr. Alex Chan from the Integrative Naturopathic Medical Center at 1285 West Broadway, or take a moment, check them out online while we do the break. It's integrative.ca. We're back after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.